Hi guys, I'm Vyshnavi Burra and you are on the Vyshnavi Show. And today here we have Dr. Pranav Reddy. He's an aesthetic plastic surgeon. So, hi doctor.
Hello, Vyshnavi.
Please introduce yourself to our audience.
Okay, I'll do my best. Hi, I'm Dr. Pranav Reddy. I am the owner and the proprietor of Neurosculpt Aesthetics. We are based in Kokapet. I'm a plastic surgeon, so I do a lot of surgeries across the board. We treat everything from trauma and now a lot more into aesthetic surgery, which seems to be the trend that everyone wants to get on board with.
So, doctor, I would just like to know why did you get into this profession? So, is there a backstory?
I hope it's interesting enough. But so I come from a family of doctors, all of
Okay.
us, my parents, my wife now, and
Okay.
my sister and my brother in law. But medicine has probably been the easiest journey for me to get into. It's been a long journey, and I'm much happier doing surgeries. Like, I cannot be a physician.
Okay.
So I had an inclination to do something related to cancer for the longest time. So
Okay.
plastic gave me an entry into that. We wanted to do onco reconstruction, which is
Okay.
reconstruction after cancer surgery to remove the cancer. So that's why I got into plastic, and then slowly went away from that and got into more aesthetics because there is a lot more avenue for growth in this. Plus, there's a lot more advancements in this field that are constantly coming out, which we'll be discussing a lot more
Yeah.
on. So I thought better to keep progressing and moving forward, which is why we stuck to aesthetic plastic surgery now.
Definitely. And again, I also would like to ask you, as you treat a lot of patients, right? In India, plastic surgery is kind of a taboo.
Yeah.
And tummy tucks, all these things are quite common in the West. But
Right.
what would you like to say about it?
True. I mean, I think what people have to realize over the course of time is all you're doing when you come to a plastic surgeon is taking care of yourself. Just like you do it with washing your face in the morning or brushing your teeth. This is a step ahead of that, but it's something that is a personal decision. And if you look good yourself, then you'll feel a lot better. You get a lot more confidence out of it. And then you go about your daily routine without worrying about the stress of body dysmorphia or anything else that is preying on your mind. All we're trying to do is take away one of your stressors through our plastic surgery.
Yeah.
And like you said, it's a lot more popular in the West, and we always mimic the West.
Yeah.
So whatever happens here is probably a few years behind there, but it's not like it's an impossibility.
Yeah.
And Hyderabad is at the cutting edge of aesthetic plastic surgery as well, because Bombay and Delhi are probably the pioneers in India. Hyderabad is following suit very quickly. We have a booming Telugu film industry where looks matter a lot more as well. So why not give what the people want right here in the city?
Exactly. And even nowadays, even celebrities are opening about their surgeries and all the treatments that they are getting done
Yeah.
to look aesthetically pleasing.
Yeah.
So, a lot of people feel like, okay, it is not for common people, it is only available for the celebrities.
Yeah.
So, I think there is a misconception that's going on. What would you like to say about it?
I think before it was definitely there. If you had to get plastic surgery done, you either had to be a model, an actor, a host, or a hostess, and that was pretty much the limit.
Yeah.
But nowadays, it is a lot more affordable, it is a lot more acceptable, and it is a lot more easy for us to explain to people. People are a lot more knowledgeable as well, whether it is half knowledge or full knowledge.
Yeah.
But we try to give them the entire concept of what they're undergoing, how easy the transitional process will be, how easy the recovery can be, and how it is necessary for some people to get it done. In today's day, when you have Ozempic, you have fat loss, you have people who are going through massive weight loss,
Yep.
you have post-pregnancy people, you have people who have body dysmorphia. Some of our procedures are essential for people, some of them are add-ons, and some of them are just frivolous as well.
Okay, so whenever we talk about plastic surgery, right? So the first thing that pops up is a nose job because
Right.
almost everyone is open about it,
Yeah.
or almost everyone has gotten it done.
Sure.
So, who should consider a nose job?
Yeah, good question. So, rhinoplasty is what we call it in surgical terms, a nose job. So, a nose job is basically done for anyone who has like functional disturbances, they have breathing difficulties, or for people who want to make their nose look better. They have a shorter nose, a stiffer nose, a wider tip of the nose, or they have discrepancies on each side. You get a nose job done to make it better and improve the flow of your breathing as well.
Okay, so it is always we consider a nose job as just aesthetically pleasing thing, but
Yeah.
it also helps with the breathing issues.
Yes, so that's why we
Okay.
combine with the ENT surgeons to do this, so that we give them a
Okay.
septoplasty and a rhinoplasty.
Okay. And what is the biggest misconception about rhinoplasty?
So one thing that everyone has to understand when doing a rhinoplasty is that it has to suit your face. You cannot get the nose of someone that you've seen on a model page because
Yeah.
you want it.
Yeah.
What we do in the rhinoplasty is fit it into the profile of your face to make your face look better, because the nose is probably the most identifiable feature about your face.
Yeah.
And we don't want it to make it look fake. We
Yeah.
wanted to make it look as natural as possible.
It's like center of the attraction.
Yeah.
Literally center of the
Absolutely.
attraction.
Absolutely.
I've also come across a surgical and non-surgical
Yeah.
rhinoplasty. Can you
Yeah.
please let us know the difference?
So not everyone is willing to do a surgery. The easiest thing for us to do to give them the look of surgery is to do a non-surgical rhinoplasty or a liquid rhinoplasty. So here we inject fillers and we give some amount of Botox to relax the muscles that contract the nose, and to also give some amount of elevation in the nose and fill the gaps that are hollowed out.
Okay.
So it's an outpatient procedure. It has to be done by a very qualified plastic surgeon, but the results can last up to 2 years.
Okay.
And depending on how they feel with that, most people end up converting into getting a surgical rhinoplasty, because the
Okay.
downtime with the surgical rhinoplasty is slightly longer.
Okay. So when you mention fillers, do they have to get it often or is it a one-time thing?
So fillers usually last for 1.5 to 2 years. Some say that fillers last forever as well, but they can reduce in volume or migrate. So people who get fillers have to get them repeatedly done. 1.5 to 2 years is the average most of the time.
So they'll be needing touch-ups.
Yeah,
Okay.
pretty much.
Got it. So, and one more major issue that is there right now among the people is hair loss.
Oh, yeah.
And there are a lot of hair treatments out there.
Yes.
So, and we also see celebrities like Ori getting a hair transplantation
Yeah.
and everything.
Yeah.
What are all the options for hair loss that you would say as
Right.
a...
So there are a lot of treatment options for hair fall nowadays. People do medical treatments, they do injectable treatments, they do surgical treatments for it. So you have everything from just topical medicines to tablets that you take, to PRP, GFC, exosomes, SMP, SVF, and then finally hair transplants, which is FUT and FUE again. So the abbreviations are a massive number already, but the details of each one is much more significant.
Okay.
Each of them has different outputs that you can get, a number of sessions, the results that you can expect from each one varies, and it's very individualized for each person.
Okay. So again, whenever it comes to hair loss, is surgery a last option?
I wouldn't say it's a last option. It depends on the amount of hair loss, the age of the person, the results he's expecting, and all his other medical conditions.
Okay.
Because if someone wants a quick fix where he wants the hair to grow back immediately, then probably a surgery will help. Also, the grade of the hair loss. If you're more severe on the hair loss scale, a surgery is the only option at that point of time.
Okay.
If you have the time, you want to make the effort, you're not worried, you're worried about hair thinning rather than hair fall at least, then you can try medical treatments, you can try injectable treatments. They take a significantly longer period of time,
Okay.
and the results are not guaranteed to last forever.
Okay.
It's not a permanent solution, but they should be tried before you dive into a hair transplant straight away.
Okay. So when you say injectable treatments, right now PRP has been trending everywhere.
Yeah.
So what would you like to say about it?
So PRP is a great molecule. It is harvested from your own blood, so it is easy for us to procure it. Everything can be done in a single center as well. But PRP is probably the gold standard for what was done, not just for hair fall, but also for facials to improve it.
Okay.
Because it has a lot of healing molecules that help in improving cell turnover and making you feel better through the process and get better results. But PRP requires multiple sessions, and you require maintenance sessions as well.
Okay.
More than PRP, a concentrated form is what we call GFC now, growth factor concentrate.
Okay.
And then you have signatory vesicles, which are called exosomes. They're not US FDA approved, but they've shown great results with hair fall as well.
Okay.
Much lesser number of treatments for exosomes.
Okay.
So all of those injectables seem to be working. PRP is gold standard, but the newer progressions are GFC and exosomes.
Okay. So according to you, can PRP be a replacement for hair transplantation or something? Because should people consider it as the first step and then go to transplantation, or?
I think for a lot of people, PRP would be step one.
Okay.
or at
Okay.
least after the medical management, if they want to pump it up a little bit more. And I'm sure a lot of people have gotten PRP done, whether they're willing to admit it or not. But PRP, what we use it for hair transplants is we use PRP as an adjunct, as in we add
Okay.
it on to it.
Oh,
So we give
okay.
GFC
Okay.
at the end of a transplant or 1 month later as well, so that it helps stimulate even more growth.
Okay.
PRP
Okay.
can be used before a transplant, can be used after a transplant as well.
Oh,
We
okay.
always use it as an add-on rather than saying that is the only treatment that you may require. Because if you're getting an injectable, you're already having some amount of significant hair loss.
Yeah. Okay. So, how many touch-ups does PRP need? Like, how often do someone get PRP?
So PRP, we usually give it once every 4 weeks. And then that's given for around 6 to 8 sessions.
Okay.
And then we usually suggest one every 6 months as
Okay.
maintenance after that.
Okay.
So
Got
6
it.
sessions followed by maintenance for as long as you want to take it.
Got it. And I've also seen people getting eyelid surgery. So, what it is also called as kind of an anti-aging thing. So, can you please elaborate on that?
So a lot of people who have droopy eyelids or fullness in the eyelids, either above or below, where they have hollowed out and the fat is drooping down, we try to correct that.
Okay.
Usually in the earlier stages, you can get injections done, like people get filler in the area, or they try to mask it with eyeshadow or with makeup. But what we do in something called a blepharoplasty, which is an eyelid surgery,
Okay.
is we try to reduce that fat in the upper eyelid, or we try to
Okay.
reposition the fat in the lower eyelid to make it
Okay.
look like smoother and more natural. Once you hollow everything out to make it look more natural, you look a lot younger as well, like how you would when you were in your 20s or your 30s.
Okay. So again, as you were mentioning, what is the difference between getting a upper eyelid surgery and also a lower eyelid surgery?
Right. So usually in an upper eyelid blepharoplasty, you have a lot of extra skin because you develop folds of skin in the upper eyelid. You also develop a lot of fat in the upper outer sides. So what we do is we take out an amount of skin. It's all measured for us. So it's a lot of geometry and architecture basis for us. And then we try to reposition the fat or reduce the amount of extra fat in the area. So you don't want this fullness to make it look like your eyelid is drooping.
Okay.
If you take it away, your eye becomes a lot brighter, your opening is a lot wider, and you don't look as sleepy or old as you would if you had fullness in the upper eyelid.
Okay.
When it comes to the lower eyelid, it's a whole different scenario again.
Okay. Again, the conditions that you are mentioning right now, having the hollowness or having more fat on the upper eyelid.
Yeah.
So, are there any non-surgical procedures for it, or do we have to?
Yeah, so what we end up doing is we usually combine like an upper blepharoplasty with something called a brow lift. So we lift this outer portion of the brow so that when that pulls it out, it repositions that fat a little bit.
Okay.
So
Okay.
in that condition, we use Botox. So when we give Botox to all of this but leave this area, this becomes a triangular area that pulls that eyelid out. So that gives the effect that you don't have that much droopiness in the outer eyelid. You also can give some amount of PDR and PDGF injections here to reduce the darkening of that area.
Okay.
You can also do some amount of Botox outside to reduce the wrinkling and all that. So there are multiple non-surgical methods of doing that as well.
But do all of them need touch-ups every
Absolutely.
now and then?
Absolutely. Botox is something that lasts barely for 4 or 6 months.
Okay.
So any amount of Botox in any area of the body, whether it's muscles, in the face, anywhere, you'll usually have to come back every 4 or 6 months for effect. And it is a downgrading effect. Like the highest effect is at 14 days and it slowly fades away in the course of the next 4-6 months.
So you were just mentioning PDGF and PDRN treatments. And I've been also hearing a lot about salmon sperm treatment, right?
Yeah.
And a lot of celebrities like Kim Kardashian or Noora Fatehi are getting those done.
Yeah.
So can you tell us a little about that?
Today's greatest advancement, I think, at least in non-surgical plastic surgery or aesthetics, is regenerative aesthetics. So regenerative aesthetics basically includes stuff that is created from your own body or naturally harvested in some way, rather than giving you filler, which is what was done for the longest period of time.
Yeah.
So PDGF and PDRN are things that are harvested, or cells or products that are harvested from cells itself.
Okay.
PDRN from salmon sperm, which is why we call it a salmon sperm facial. And these are prepared either combined with other products, like you have hyaluronic acid or glutathione, which is quite popular as well. And that is injected or applied all over your face or your neck
Okay.
And this is used to improve fine lines, wrinkles, dark pigmentation.
Okay.
It gives a little bit of tightening of the skin as well.
Okay.
And that's why it's become a lot more popular, especially since it's being promoted like by the celebrities who
Exactly.
travel all the way to South Korea to get it
Yeah.
done and then come back as well.
Yeah. Does it also help with the skin texture?
Yes, absolutely.
A
Yeah.
lot.
So
Okay.
improves a lot of dark pigmentation, tightens the skin, improves the collagen and elastin, and
Okay.
all of that helps in generally improving your skin texture as well.
Okay. So again, how long does it last? And
Right.
will we need touch-ups for
So
this?
for the products that we use for PDGF and PDRN, we combine it with a lot of other products like hyaluronic acid and glutathione. So different products give you different results. One is for pigmentation, one is for skin elasticity and improvement of tone. So what we suggest for people is to get an injection once every 2 weeks, like 2 sessions of that.
Okay. Okay.
And then maybe another 1 month later. And then it is touch-ups. So 3 injections within 1.5 months. And then the rest of it is probably touch-ups once every 6 months or so.
Okay.
And all of these injections are very superficial. So we give you some amount of numbing cream and then give you injections.
Okay.
And there is some redness and all that that's present for 2 days and then it subsides and the results are fantastic based off of that.
Great. So again, PDGF and PDRN. What's the difference between these two?
So PDGF is platelet-derived growth factor and PDRN is a riboxynucleic acid. So riboxynucleic acid is basically got from salmon sperm DNA, while the growth factor is of the surrounding factors that surround all the cells.
Okay.
So PDGF can have a combination of a lot of growth factors like VEGF, epidermal growth factor, others. And the PDRN is used to recombine cells. So that helps in, while PDGF helps in cell turnover to improve new cells, PDRN helps in improving the cells and modifying the cells itself.
All over Instagram, we've been seeing this Ozempic phase.
Oh, yeah.
Karan Johar and few other celebrities have lost weight rapidly.
Right.
And people are calling it Ozempic phase. So
Right.
what is Ozempic phase?
So I honestly don't know whether he actually took it or not. There seems to be a lot of speculation that he did. But so Ozempic has become so popular in the past, in India, especially in the past 6 months to a year, because you've gotten injectables that have come into India.
Yeah.
There were tablets for Ozempic before or similar
Okay.
products,
Okay.
but they didn't have that much effect.
Okay.
Now the injections have a much greater effect because you take it once a week. So Ozempic is basically a GLP-1 peptide. So it's called semaglutide or other alternatives. And that helps in acting like an insulin-like substance so that it reduces the amount of glucose uptake, it reduces the amount of fat, and that why it was actually created for diabetics.
Okay.
So to treat diabetes, the side effect was weight loss.
Okay.
And when it started creating so much of weight loss, the weight loss was all over the body.
Yeah.
So people started ramping up a lot of these weight loss drugs, focusing on the weight loss rather than worrying about all the other effects that came with it.
Yeah.
And one of the other effects was fat loss everywhere. You have a lot of fat in your face. The fat in your face is usually what is there to give you that lift and the plumpiness or the amount of glow that comes along with the fat that is present under it. So if you lose all that fat, you're hollowing out your entire face.
Okay.
If you hollow out your face, although you want to look thin, you need some amount to maintain natural contour.
Okay.
So if you over-exaggerate the Ozempic, then you're obviously going to look like a malnourished person as well.
Yeah.
That is what has become Ozempic face. One of the many side effects of Ozempic, and people don't know about most of the side effects of it.
Yeah, as you mentioned, it is created for diabetes patients, but a lot of people has termed it as weight loss drug instead of the actual reason it was created for. So and how do we treat the Ozempic face? Let's say someone lost
I
weight.
would say it's more prevention than treatment because you have to talk to a proper medical gastroenterologist or a surgical gastroenterologist who is taking care of your treatment of Ozempic properly, because you cannot just take it at home and just expect it to be perfectly fine, because doing your labs regularly, getting your checkup regularly, being on the proper gradation increase of Ozempic matters a lot.
Okay.
Once you have actually lost that significant amount of fat, then if there are ways to either quickly improve it or improve it over the course of time. If you're willing to take care of your diet healthily enough, then gradually there may be improvement. But if you have a significant amount of weight loss in your face that needs to be improved, then we're looking at re-injecting fat basically. So like we do fat grafting for faces, We
Yeah.
try to improve skin tone. If you want to just resurface the skin, we have lasers. If you want just a filler, then we use fillers for wherever it's hollowed out. So you have
Okay.
multiple modalities of treatment options for it.
Okay. So fillers will help
Yeah.
in giving that younger look,
Yeah,
even they
yeah.
have a Ozempic
Because they
face.
lift, they hydrate, they plump up, which is all that is lost in an Ozempic face.
Okay. So, and I've also come across RF microneedling. Again,
Yeah.
we see a lot of vampire facials, even mostly Kim Kardashians, we see them using all these vampire facials and everything. Why are they trending with celebrities? I mean, what do they do essentially for the skin?
So, microneedling is a process that we've spoken about already, I think. And microneedling is something that just creates multiple small holes or pores in your skin by using a pen or an RF microneedling machine. So, through that microneedling, the multiple holes that are present slightly apart from each other allow new collagen, new elastin to form. So it resurfaces the skin quite well. And at the same time, what a lot of machines do, or what we do, is we apply some amount of ointment or cream or PRP or GFC or exosomes over that area so that it seeps into the skin and further helps in making it the cell turnover better, the collagen better, improving your skin tone even better.
Okay.
So it's an add-on to your microneedling experience, and radio frequency microneedling, as RF microneedling is, also helps in skin tightening, so that it remodels the collagen a little bit and tightens your skin, thereby giving you a little bit of lift and making you look slightly younger than you were before.
Okay, so when we are talking about microneedling and PRP therapies, right? One thing people would be most scared of is, okay, they're injecting something. It might be painful. So they'll have all these feelings of fear. So how do you deal with that? I mean, do we have anything for that?
So usually with RF microneedling or with microneedling pens, they are less than 0.05 or zero point 0.5 of a millimeter. And we usually have 12 pens. It's very, very painless most of the time when we do it. But even if there are people who have a lot of sensitive skin, we apply a local anesthetic cream all over, allow it to settle for around 30-35 minutes, and that numbs the entire face.
Yeah.
So when we do, whether it's laser hair removal or whether it is this process or whether it's RF microneedling, all of the procedure is quite painless most of the time. You just feel pressure over the course of the area, but no pain as such. That's why we don't ideally inject PRP with like an insulin syringe like you would with Botox.
Yeah.
We apply it after doing microneedling.
Okay.
So that way it's just an application after very small pores that are created, and we allow it to settle over the course of some time so that that seeps in, and then you don't have to worry about the pain of individual injections.
Yeah.
Because with PDRF and PDRN that we spoke about earlier, it is easier to inject to get better results, but you can also do the same thing like this. You can microneedle and just apply it like a lot of people would do.
Okay. And what is the difference between Morphosate and RF microneedling?
So Morphosate is a company. Basically, they have one of the greatest products when it comes to RF microneedling. RF microneedling is the entire treatment process. So you have multiple machines that do RF microneedling. So radio frequency microneedling, radio frequency to tighten, microneedling to resurface the skin as well. So one of the greatest products is that. But there are multiple ways of doing it, which probably there are 20 or 30 companies around the world who do it.
Okay. Yeah. So, and again, who is it most suitable for? Who should get microneedling done?
Yeah. So everyone, honestly, from the age of 20s to 30s to 40s to 50s, if you're considering or you feel like there is loosening of the skin, there is sagging of the skin, you want some amount of lift, you want some amount of skin resurfacing, you want tautness of the skin to come back, then try RF microneedling. It's an outpatient process. You need multiple sessions, but the results are good. And a lot of people who consider facelift in their 50s would have had microneedling and RF done over the course of time, because nothing replaces a facelift, but this probably prepares you for that over the course of time.
Okay. So does it also anyway slow down the aging for people?
It does to an extent. Slow down, probably not, but at least I guess slow down is a perfect word for it. It does slow it down to an extent. So we do fractional CO2 lasers as well. So that also resurfaces skin significantly, but the downtime is a little more.
Okay.
MNRF or RF microneedling is the downtime is a lot lower.
Okay.
And it does somewhat of a similar effect to a fractional CO2 laser.
Okay.
So if you're looking at products, and fractional CO2 is probably the best results for skin aging, and then MNRF, and then you have a lot of other injectables that help as well. But the
Okay.
best of everything else would be a facelift at the end of the day.
Okay. So again, I've heard a lot about Botox and almost everyone gets it done.
Yeah.
But I've recently come across a term called baby Botox.
Right.
What is it?
So baby Botox is what a lot of people in their 20s nowadays get done. It is,
20s?
yeah,
Oh, wow.
absolutely.
Okay.
So it's a prevention kind of thing. It's one of the steps that we see as an add-on to anti-aging. So baby Botox is micro-dosing of Botox.
Okay.
Like say you would give 2 units of Botox for your forehead lines once you've developed the wrinkles. This is preventative to an extent. So we give one unit or half a unit in that particular area so that it preempts any wrinkles that produce. Same around the crow's feet, around the darker
Okay.
lines. Before you get it, if you give some amount of baby Botox, it
Okay.
helps to retard or slow down the formation of wrinkles over the course of time.
Okay, but won't that give a fuller kind of look? Maybe some swollen kind of a look?
No, fortunately with Botox, I think that's a big misconception for us is that people confuse Botox and fillers a lot. So fillers hydrate and increase the size of anything.
Okay.
Botox on the other side is a muscle relaxant. So all these lines that are created here would be lost with Botox.
Okay.
So your muscles get stopped. So you can't cause all of the wrinkles that come around your nose, your eyes, your forehead, and everything else. So it
Okay.
looks like you have a smoother contour rather than a fuller contour.
Okay. And as you were mentioning, people in their 20s can get it done. I mean,
Yeah.
is there any criteria or any 20-year-old can get it done?
As long as they understand what the procedure is, they have proper consent for the procedure, they understand that this is not something that is ideal for a young 20-year-old, but it is a preventative measure. And it doesn't become, because we have heard of stories where people get it done so repetitively that it becomes an addiction.
Yeah.
We want it to be something that is just sporadically used for people rather than them to do it every single time they have something that they want to get it done for.
Okay, so if they are completely aware about it,
Yeah.
almost everyone in their 20s can
Yes,
get
above
it done.
the age of 21 with a proper consent, with a proper consultation, and not overdone just because
Yeah.
the patient asked for it.
Okay, and how safe is it?
Very safe procedure, honestly.
Okay.
Done in the right hands, Botox can be done within 5 or 10 minutes.
That's it.
Yeah, we apply the ointment again, which takes some amount of time to numb it. Some people don't even want the ointment, they just
Yeah.
take the injection.
Yeah.
You measure it out for each area, microdose for that area. The procedure takes less than 5 minutes and you walk out in 10 minutes after the procedure is done. But the consultation before is so much more important than the actual injection.
Okay. Wow. Okay.
Yeah.
So again, coming to anti-aging, as we are talking about anti-aging, I've also come across stem cells and exosomes.
Yeah.
So can you please elaborate on that?
So exosomes is a little bit of a controversial topic, just like PDRN and PDGF right now, because they're recent advances. They've not been in the market for long.
Okay.
Exosomes are not US FDA approved. That has to be said. So they're not used in the US as much. They're promoted significantly in the US.
Okay.
But we here in India use them because they have been used in South Korea for at least the past 2 years or so. In our setup, we use exosomes for hair fall, and we show a great amount of results with hair fall. Usually, like if there are, it shows almost 1.5 to 2x increase in amount of hair growth over the course of time, which is doubling of hair growth is significant for people with hair loss. You can also use exosomes to help with facials as well. Just like when you do microneedling or you do a laser and you would apply exosomes over that as well. Otherwise, most of the time we inject it into the scalp to help with increase of hair growth.
Okay.
Yeah.
So do we only use it on our hair and scalp? Do we also use it on our face?
A little bit for the face,
Okay.
but I prefer to use it for the scalp more than the face right now.
Okay. So can it be called a new age Botox?
Yeah, I mean, it's similar to regenerative aesthetics. I wouldn't say it's like Botox because Botox is a muscle relaxant. PDGF, PDR, and all of them are similar to lines like PRP or GFC and those kind of lines because they help in the cells recreating themselves or improving their aesthetic more than slowing down a muscle as such.
Okay. And with this treatment, what should people expect?
So with exosomes, hair fall improvement is significant. We do a session once every 3 months and that is done twice. And after that, it's only once in 6 months or 9 months. So it's not done as often as PRP does. So we use this as an alternative to PRP or GFC.
Okay.
And for facials with exosomes also, it's quite similar. You would do it maybe once in 2 months. And then again, dependent on how much you wanted, we would continue to redo it over the course of time.
Okay.
It shows because they're signatory vesicles and they try to improve the outcome of individual cells. They have a lot of cell turnover. They help with tightening of the skin. They help with collagen remodeling. Maybe not as much dark pigmentation,
Okay.
but definitely
Okay.
help with the tone of your skin and the texture of your skin as well.
Okay. So it is also kind of considered as an anti-aging thing.
Yeah, absolutely.
Okay.
Absolutely. A lot of products in the market, a lot
Okay.
of improvement recently, and a lot of regenerative aesthetics that are becoming a massive trend, not just for us, but also for dermatologists.
Definitely, definitely. Even people are more aware about all of these things, obviously through social media nowadays.
Yes.
And I'm also kind of happy that even celebrities are speaking about it openly these days and they are just showing these treatments.
Yeah.
But the thing is, people feel like they might not get their hands on it. They have this feeling where, okay, it is only for celebrities.
Right.
I might not be able to get. As you said, even in Hyderabad, we are just introducing all of these things and it is very new to people.
Yeah.
And they might also kind of think, especially women, might think like, okay, do I really need to get it done? Or
Yeah.
it's like a taboo, basically.
Sure.
Doing something for themselves seems like selfish or whatever. So, and people might judge. All these things come in their mind. So, what would you like to say to such women?
I would say go out and do whatever makes you feel good, honestly. I don't think any woman should step back from getting something done to make themselves look better or feel better. If men can go out and work out and travel, and so can women, then this should be just something else that is on your checklist.
Exactly.
And if it's a surgery or a non-surgical procedure, I don't think anything should stop you apart from the unavailability of it being here. And that is not a problem today.
Exactly.
Everything is available. You have professionals who are very good with doing it.
Exactly.
The main thing that you should do when you talk to anyone also is that you get a proper consult, you get a full counseling, you ask them all the questions, and the doctor that you go to also should be receptive to telling you everything that you
Exactly.
want. If you see any red flags, then step away from that situation. But choose carefully. Don't back down because it is told by your aunt or the friend around the corner that you should not get it done.
Yeah.
Go out and do it if you want to do it, but don't do it because someone else said that you should do it.
Exactly.
Do it because you want to do it more than anything else.
Exactly.
We use it as a stepping stone for anything else. Whether your face is the window to the world, your hair is shown to people. If people notice it, then it gives you a lot more confidence, makes you smile a lot more, makes you feel a lot happier.
Exactly.
And then we can help with your body contouring after your efforts are already made. Everything is an adjunct. We are not saying that this is the only thing you need to get done, right? This is an add-on to whatever you've already done before.
Yeah. And also, lifestyle definitely
Absolutely.
matters a lot.
More than anything else.
How much ever we talk about the treatments, and their lifestyle definitely matters a lot more.
Without a doubt. Lifestyle is primary.
Exactly.
Your habits, your food, your diet, your exercise are more than anything else that we can do in a surgical theater or in my consultation room.
Exactly. So, doctor, this has been very, very insightful, and thank you so much for being on our show. So, do you want to say anything to the audience?
It's been my pleasure. Thank you so much for asking me all these questions, because I think the biggest thing about this was just for us to give out information so that people can make an informed decision. So, thank you.
Thank you so much.